Hi everyone, myself Dr. Parv. We are discussing pediatrics and I am your pediatric faculty. Welcome to Kidscovery. We are discussing actually the syndromic approaches in pediatrics, okay, pediatric syndromes. I don't know, there's a little glitch on the part of my team that they have mentioned pediatric infectious disease, kindly excuse that. So coming on to the pediatric infections, and we are discussing about the VACTERL abnormalities. Now what do you mean by VACTERL abnormalities? Please understand. So basically VACTERL is an abnormality which is sporadic. The etiology is unknown. It is thought to be, believed to be multiple genetic and environmental factors. And what is VACTERL? V for vertebral defects like scoliosis is the most common one. So this is the first MCQ which is actually asked, that which vertebral defect is the most common one. It is the scoliosis. Then A for it is anal atresia, C for cardiac abnormalities, T for tracheoesophageal fistula, E for esophageal atresia, R for renal defects and limb defects. Okay. So the important part is that any three, more than equal to 3 features are required for the diagnosis of VACTERL abnormalities. Okay. So this, can you see this R and E coming? So this R and E coming, THR double E coming. So this R and E are important. Why? Because you have to remember that more than equal to 3 if are positive, then we can say that it's the VACTERL abnormality positive. Coming on to the asked MCQs, very important MCQs which are asked, like what is the most common vertebral defect? That's the scoliosis. Anal atresia, if it is going to be there, how it's going to present. So if the anal atresia is there, that means anal opening is not formed properly. That most of the times is going to be present with the intestinal obstruction. Cardiac defects, they are going to present with the arrhythmias and the heart failure which is going to be there. Tracheoesophageal fistula will have a feeding difficulty. Of course, because it's a fistula, so the contents can go from the esophagus into the lungs, and while going into the lungs, it can cause the aspiration and pneumonia as well. In renal defects, vesico-ureteral reflex is something which is seen. So vesico-ureteral reflex means the content or the urine is going to go from the vesicle, from the bladder into your ureter, and there it can cause UTI. In limb defects, of course, it can cause some radius abnormalities. This is important, and thumb hypoplasia. I have seen they have asked this, in one of the competitive exams, they have shown you the chest x-ray of hand, and then it was the radius which was not formed properly, and the thumb was also hypoplastic. So what to do in order to see the vertebrae? Do x-ray, do MRI. For anal issues, do physical examinations and abdominal USG. For cardiac problems, do echo. For tracheoesophageal fistula, there is something which is called as NG tube test, nasogastric tube test with x-ray. So this is something which is done. For renal issues, we have to do USG, and for limbs, do x-ray. And of course, supportive and surgical correction is something which is required. So you can see this is the limb abnormality. Can you see this is the limb abnormality? You can't see any forearm bone. So that means the radius has not formed. There is no forearm bone which is formed. Okay, let me write down. No forearm bone which is formed. Okay, yeah. Next, can you see there is no anal opening which is there? So there is going to be something which is called as anal atresia which is going to be there. Then this is the cardiac abnormality which is going to be there. Cardiac abnormality, okay, which is going to be there. And of course, the vertebrae can be seen like this, scoliotic. So scoliosis is there. These pictures, yeah. So can you see the coiling of the tube as well? So tracheoesophageal fistula is also going to be there. This picture is something which I can't comment on because that's not very clear. Okay. So this is something which you have to understand. Now there is a beautiful question which has been asked, but before that question, let me just show you. So can you see this is also one of the good way to show you this. The trachea, esophagus is involved. Then coming down you have cardiac, and behind you have got vertebral problems. Then you have got anus in the anterior part, renal in the posterior part, and of course limbs and the radius. So let me just write down this beautiful question for you. Question says intellectual disability. Intellectual disability is seen in, okay, intellectual disability is seen in. So your options are option A, Turner syndrome, option B, VACTERL abnormalities, option C, charge abnormalities, and option D, more than one option correct? Okay, so this is a question which I will leave you with, and I'll wait your response in the comment section. Thank you so much for watching. God bless you.